Hi everybody, I'm Dr. Deed Harrison here with Chiropractic BioPhysics Seminars and Technique and Chiropractic BioPhysics Nonprofit, a spine research foundation. What we're going to do in this video presentation is continue our research reviews of CBP nonprofit scientific publications. Specifically this time, we are going to go through a letter to the editor that myself and my colleagues received through the journal Dose Response regarding this particular manuscript. So if you recall, our manuscript here was published in the middle of 2018 in the journal Dose Response. X-ray imaging is essential for contemporary chiropractic and manual therapy spine rehabilitation. Radiography increases benefits and reduces risks. This was a literature review commentary by our lead author, Paul Oakley, our colleague, Professor Jerry Cutler, and myself, Deed Harrison. Now, we knew that this would be a controversial topic due to what's happening today across spine care disciplines. You're seeing this thing called the Choose Wisely campaign, which was really spearheaded and put forth by the American Board of Internal Medicine, the ABIM. Now, their recommendations regarding X-ray had to do with generalized acute low back pain in a medical setting. Problematically, many groups have picked this up, including the American Chiropractors Association, in an effort to try to limit and apply these choosing wisely recommendations, which have turned into almost a guideline to try to say chiropractors should not take X-rays routinely of their incoming patient populations, and there's no evidence to say that spine radiography and spine analysis on the X-ray has any impact or bearing or any clinical significant meaning to the patient's clinical health status. Thus, the radiograph is unwarranted unless you have a history that's indicative of red flags like cancer, fractures, dislocations, infections, things of that nature, right? So this has become a very hot topic, and we knew that this article was going to be controversial because our position in this article was really, hey, wait a minute, there's a subgroup of physical applications in healthcare that require spine radiography and spine analysis. Letter to the editor criticizing our particular paper that I just showed in the journal Dose Response. They did this on behalf of the World Federation of Chiropractic via the Research Council. The problem is here, I don't know, and my colleagues don't know, Jerry Cutler and Paul Oakley, we don't know, is this the position of the World Federation of Chiropractic? Is this the position of their board, the entire council? Or is this just the position of the World Federation of Chiropractic Research Council that I will refer to as the WFCRC in this particular presentation? So here it is. Here's the end of their letter to the editor, and you can see, with respect, the World Federation of Chiropractic Research Council. And the following individuals, I'm not going to name them, you can read their names for yourself, are listed here. And then in conjunction with 3 other people. In other words, they're using the name of the biggest organization in chiropractic to try to say that this represents the world in terms of chiropractic. Now, I have no choice but to believe that for now, the World Federation of Chiropractic, also the WFC, endorses this viewpoint. In their letter, they go through some points, and I will go through their points and then our rebuttal in our rebuttal letter to the editor, where they say the following at the end. Given the above that they've written, we request that the editors of the journal Dose Response retract the commentary in question immediately. Now, I got to take a minute here and tell you that this is a very, very serious statement. By doing this, they're accusing us of some type of fraud or some type of non-scientific, non-ethical reason to have written this paper. The only time that articles are retracted from the peer-reviewed literature is if there's a serious flaw with the data or it's proven that there was some kind of serious conflict of interest, ethical concerns that led the authors to this conclusion. So basically they're challenging the entire premise, and they're challenging us as authors from an ethical point of view. That's the way I see this. The good news is the editorial board of the journal Dose Response did not retract the article in question just based on the WFC's letter and their opinions. Okay, so to begin, the WFCRC, that's what I'm going to call them, their criticism number one: we know of no reputable clinical practice guidelines that suggest radiological imaging is a routine requirement for effective treatment. Okay, so at first you don't realize exactly what this statement really means from a logical perspective. So I don't mean like, you know, the concept of it. I mean the actual course in college logic. We need to break these arguments down and see what they mean. The reality of this type of statement, it's a very egocentric driven statement, and egocentrism in science can be classified as what's called the curse of knowledge. What it means is you have a certain knowledge base that you hold to be true. Because of that, you have a certain ego around that you think that you could not be wrong in this area because of your scientific foundation. The problem is when there's actual data, legitimate data, as good, if not better, that conflicts with this, you're inclined to reject that. It's called the curse of knowledge. It's a type of scientific egocentrism, and it's a type of logical fallacy, if you will. Another issue with this is that the exact way that this is written is that if we don't know of any high quality guidelines, then there can't be any. Because our knowledge is so clear and so sound, if we don't know of any, then there isn't any. And then to continue that, if there isn't any, or excuse me, if you do find one, then it's likely not high quality, so we can choose to ignore it. That's the way this is written. So it's written as a statement that if you're carefully reading this, you'll find out that they've tried to basically say there isn't any literature, and if there is, it's not quality anyway. And here's an excerpt from those PCCRP guidelines. Spine radiography for the assessment of spine subluxation, spine displacement in children and adults. Here's the rationale and reasons why a chiropractor might look at X-ray as part of the working diagnosis for the patient's condition. Does the patient have significant altered posture that relates to their condition? If yes, then these things. So the first thing, WFC, sorry, we believe you're wrong, and data in the literature shows your statement is nothing more than a non sequitur. It's an appeal to authority, and I call it a logical fallacy. Number two, when imaging is performed, there is evidence that it does not improve patient outcomes, but it results in undesirable and unattended effects. Okay, so I look at this and then they say, not only does it not improve anything in terms of a patient outcome, so what they're saying is there's no support that it improves patient outcomes, and we'll see that this is linked to another one of their statements, but now they're saying there's actual evidence that says that it actually impairs the long-term outcomes of a patient. So let's look at their references for this. 4 references more than 10 years old were used in this letter, 4. One of them is an MRI study that doesn't apply to X-ray at all by Ash, 2008. Why bring up MRI in a debate about spine radiography? Okay, so number one, 25% of their references are just absolutely inappropriate to this topic. We're not using MRI to routinely evaluate patients' alignments to pursue care. So why you bring it up? Why? They make it look like there's more evidence than there really is, in my opinion. The second reference by Carey et al. Carey et al., 2002, British Journal of General. Carey et al., in fact, identified patients that received X-rays for their low backs at the end of care had better psychological well-being and less depression at 1-year follow-up. Interesting. How is it then that the WFC and the Carey group can say that the evidence says that X-ray has a negative impact on a patient? Why? Because they ignored some of their own data when they wrote the abstract. You can only truly find the evidence for this when you read the full text paper. There is a sentence of this in the abstract, but when you read the full text paper by Carey et al., they actually identified that people that got X-ray had better psychological well-being at 1 year follow-up. That, to me, does not say what the WFC claimed it said. They said that it impairs long-term outcomes. In fact, it shows that maybe the WFCRC is the one with psychological disorders. That's just me. I don't know. You know, food for thought. Sorry for that, but you know what? These are thoughts that go through my mind when I'm reading these things and when I'm speaking to you. The patients did better at 1 year psychologically that got X-ray. How is it that the WFCRC then can accurately use this reference and say that it has undesirable effects at long-term follow-up when you give patients X-rays in primary care practice? These people had clinically significant improved outcomes at long-term follow-up compared to those that were randomized to both either a non-radiography group or a radiography group. Oh, do you mean the WFCRC ignored this part of the Kendrick study because it doesn't fit the agenda to try to remove chiropractic X-ray rights? I don't know. That's one take on it. It could be that I don't know if they even read the full text. I don't know, because this wasn't even mentioned in their letter to the editor. They said that having X-rays, blanket, when patients get X-rays, it makes them worse. That's what they said, undesirable, unintended effects. Well, I guess improved outcomes could be considered an undesirable effect, but then you would say that's good for the people that were allocated to an X-ray right to choose group. You get the point? There's so much data that is misrepresented when you make these one-line blanket statements. On to the criticism number 3. The WFC. We, the WFCRC, we do not know of any high-quality evidence to suggest that regular imaging is needed to improve the safety. Okay, again, a non sequitur, an if-then statement. There aren't any, and if you do find any, they're not quality. Well, the reality of this, did you know that there's actually a plethora of studies that have been done to show that there are potentials for transient bad outcomes of chiropractic spine manipulative therapy? There's multiple trials that have been done on this topic. They started in the early 2000s. If you by Beck et al., here's the references to support that. For example, I take an X-ray of somebody that has acute uncomplicated neck pain and headaches. Look at this. Lo and behold, there's occipitalization of the skull and atlas. I might want to be aware of that if I was applying forces to the cervical spine or giving general. How about an instability? Look at C4 on C5. Might you want to know that they have that before you try to adjust C4 on C5? What if a person, God forbid, goes and gets arm pain after this? Do you think the WFCRC letter to the editor is going to support you, or do you think it's not going to support you? Okay, what do you think is going to happen? What do you think is going to happen? Your malpractice, you're going to get dinged on this. How about this? Look at this instability. Look at the instability at C5, C6. Look at the degenerative joint disease. Instability. How about a compression fracture? How about a retrolisthesis at L5? How about a degenerative de novo scoliosis in an adult with uncomplicated low back pain? The summary. Our letter to the editor rebutting their letter to the editor. We are surprised by the theme and logical fallacies from the WFCRC, where they use strong appeal to authority and authoritative citation arguments. In the end, they call for the retraction of our manuscript without proper data or actually proper critique of our position. Their letter exemplifies a form of scientific egocentrism known as the curse of knowledge. These WFCRC authors find difficulty suppressing the content of their personal knowledge base and beliefs when trying to reason about a less informed but still legitimate evidence-based alternate perspective. We pointed out 5 examples of where the WFCRC arguments are fallacious and we rebutted these. We demonstrated how they misused references, ignored others, and used opinions to dismiss findings from several published randomized trials. How is it that these individuals and others can make the following statement? That there's no evidence. The fact of the matter is, there is evidence. There's just as much evidence, and there's evidence to show that they're wrong. In fact, the weight of the evidence might lie on the side that routine X-ray is needed in clinical practice to achieve proper outcomes of care. When you look at what's happening with low back pain and neck pain around the world, it's not being solved. Why? Well, people are not using alignment to influence and direct patient care and patient outcomes. Hopefully you enjoyed this presentation. On behalf of CBP Nonprofit and my colleagues, Dr. Paul Oakley and Dr. Jerry Cutler, hopefully you enjoyed this, and until next time, thank you.